Hi, and welcome to the Gritty Nurse Podcast, an unfiltered discussion related to health and healthcare. My name is Amy.
And my name is Sarah.
And we are your podcast hosts. So just remember, we have our Gritty Nurse apparel line. Go to www.grittynurse.com to subscribe and get yourself some great swag.
And we also want to let all of our listeners know that we have a Patreon account. You can find us on patreon.com/grittynurse. If you're listening on Apple Podcasts, Google, Spotify, Amazon, or any other podcast platform, just be sure to hit subscribe so you can get a notification every time we have a new episode. Also, don't forget to rate and review us.
Hi, and we have a really awesome topic today. I'm so excited for the guest that we have.
I am so excited today to introduce Linda Silas, who is the president of the Canadian Federation of Nurses Unions. This is a 200,000 strong member organization, and she's been the president since 2003. She is a dynamic and charismatic leader of Canada's largest nurses organization, and Linda is recognized as the foremost advocate on behalf of nurses in Canada.
Linda champions greater understanding and action on social justice and the social determinants of health and key policies that will enhance socioeconomic equity, such as retirement security for all of workers, a national pharmacare program, and universal childcare, as well as greater access to public health services for Indigenous communities.
And Linda believes healthcare, like education and decent work, is a human right. She embodies the Canadian Federation of Nurses Union's motto, where knowledge meets know-how. And I think what I wanted to say is a lot of this aligns with what we believe here at the Gritty Nurse Podcast. So without further ado, welcome, Linda. Thank you for joining us today.
It's an honor. Thank you to both of you for the invitation.
We're so happy and excited to have you on, and I feel that you have so much to contribute to the conversation. Just to kind of get into the conversation, maybe Linda, you can tell us a little bit about the CFNU.
So the Canadian Federation of Nurses Union was created in 1981. So relatively, we're quite young in the labor movement. We're a federation of 8 nurses unions across the country, plus the Canadian Nursing Students Association. And we're there to keep an eye on what Ottawa's doing. And what Ottawa's doing has a direct link on what the province and territories are doing. And of course, how it ends up on our nursing units. We focus mostly on healthcare, but as you read through my bio, healthcare is like a mesh. It's like a mosaic of different social economic issues, which we all have to address.
Amazing. So that is quite the spread that you have there. I think that there's a lot of good work that you're doing, and maybe we could just talk a little bit about this year in review and sort of what your take is on how Canada has handled the pandemic and any learnings that have come out of it.
Yes, well, both of you being nurses, you know, this year was supposed to be the year of the nurse. And I have to put a few exclamation mark, and that's being polite, because it's been excuse my language, but a hell of a year. It's been a roller coaster for nurses across Canada, nurses across the world, honestly. None of us really lived a pandemic before. There's been different epidemic across the country or mostly across the world. But what we were more surprised is how we had to fight to have proper staffing, to have proper PPE, personal protective equipment. And still, 9 months, almost 10 months into the pandemic, there's still some areas of our healthcare system that nurses, healthcare workers are fighting for proper protection. And this is probably one of the most frustrating, sexist, disgusting period of my career. I never expected us to be here.
You know what, Linda? I am so glad you said all of that because we feel that too. And I feel that the whole idea and how it has been mismanaged. Like, I know that there's a document and I read through it called A Time to Fear and really how Canada mismanaged COVID-19. And I think that for nurses to hear that we stand in solidarity with understanding that the system crippled us. It's crippled us in a variety of different ways. I think that it's empowering to hear it coming from you as well. And it really helps validate how nurses have been feeling. And I think the conversation and the discourse around PPE, it was a hot mess, right? Like it was a crap show in terms of, is it airborne? Do we need an N95? Do we need just like a grade 3 surgical mask? And all of these various different conversations were happening, and nurses were stuck smack dab in the middle of it and not knowing what were the right actions to take. So I actually pulled out a couple different things here from the document that I kind of wanted to touch on. And one of them was just like a statement read by the Canadian Federation Nurses of Unions that says, as nurses, unions, we've repeatedly asked the government to identify both the supply and demand of personal protective equipment in order that we can work with governments and health authorities to implement strategies that focus on reducing hazardous exposures. And we know, and I looked at the stats and saying, like, I think it's 19% of healthcare worker exposures to COVID-19. And there's been over 2,500 nurses and physicians who've actually gone on to actually contracting COVID. And it's all about surrounding how better we can protect nurses. So, like, what's your thoughts on some of that?
I think you explained the frustration of nurses well, and the confusion. To hear their union, and we started at the end of January of 2020, writing to the federal health minister that we've been through this before. Toronto was hit with SARS. We learned from SARS that you had to establish the precautionary principle, which is simple. If you don't know 150% how a virus is transmitted, you take all the precaution, which includes airborne. We really thought, and I came back in January from a trip and landed in Canada and realized, okay, we might be hit with this coronavirus,
Mm.
but we're ready. I was confident. I was telling our federal health minister, we're ready. We had a practice run with H1N1, with Ebola. Nurses and health managers knew what we needed to do to keep our healthcare workforce safe. And then something happened by early March where whoever, in their wisdom or stupidness,
Mm.
decided to downgrade the protection of healthcare workers to droplet protection. And that brought confusion across the system. You mentioned about 2,500. The numbers change every day. We know there's about 40,000 uh, essential workers that got infected with COVID-19. That's just in our
Wow.
country. And that we're talking about a very rich country. And that we also know the impact on what it has had on the workforce, because some are either sick, some are in self isolation, and a lot are dealing with a mental health issue, with stress
Right.
issue, with family issues, and what's going to come out of the end of this tunnel.
Yeah, like it's really crippled women in general, and understanding that we
Mm,
are a dominated profession. It's just kind of like, I feel that we're being silenced in so many different ways. And even circling back to the
mm,
whole like aspect of the PPE, one of the things that really stood with me for the longest time, we're seeing and hearing some of the comments of nurses being refused certain types of PPE,
mhm,
namely the N95. And how people were keeping it under lock and key, and even hearing about nurses wearing, at the height of this, plastic bags, garbage bags, to protect themselves. And just how it seemed like the government was not doing anything, and how
Mhm,
horrifying it
mhm,
really has been.
yeah. The government, and we have to say government and governments with an S, because there's
Mhm.
several level of governments in our communities. I know most of your viewers are from Ontario, but there are some of your viewers are from across Canada.
Mm.
So every government acted in a different way, which only brought even more confusion to the system. We have
Absolutely.
municipality districts like the city of Toronto. Bless their heart, have been strong, have been really strong policies, sometimes even better than what the provincial or federal government was doing. They were putting pressure. And then you have smaller communities that are cutting back on public health nurses in Ontario. Like, shame on them. How do you think we're going to
Right.
deal with a public health crisis by cutting them? Some facilities, big hospitals, were only thinking of their intensive care. As long as my intensive care are well staffed, well protected, we're not going to worry about the rest of the hospital. But not we, they were forgetting about the entry to a hospital, which is the emergency room. Or when we have COVID-19 patient, how they have to be in specialized unit with staff that is trained to don and doff their personal protective equipment and enough staff to do it. I saw
Yeah.
a reporting from Alberta and I had to chuckle because uh, one woman, and she mentioned she was a healthcare worker, which she wasn't. She says, can you imagine they're even paying staff to look at other staff get dressed and undress? Like, for the general public, they don't understand the importance of the donning and doffing, and how it's important, so easy to make mistakes. And if you do it wrong, you get infected. And it's part of our process, and it's part of our learning, and us as working as a team is trusting each other. But that, with weird and government policies, a lot of mistakes have been made, and we see it by the number of nurses, healthcare workers, personal care workers that have been injured, infected, and don't know where to go next.
Yeah, and I feel so much of this could have been prevented. Like, I think your report outlines, like, we've seen this before. We have structures and measures in place in terms of when we had SARS here, how we can
Mm-hmm.
best protect ourselves, and for whatever reason we just missed the mark. I
Mm-hmm.
just don't feel that anyone should have really died, especially healthcare workers, because of this.
Yeah, we don't know how and if we missed the mark, to be honest.
Mhm.
We will know one day. If you look at SARS, and we hired Mario Possami, who was the senior investigator with Justice Campbell in SARS, to tell us what happened in the first wave. We're all getting ready for the second wave, but there's a lot of access to information that has been closed. Like, we know there was a weekend in Ontario that the policies change. We have to know what happened that weekend,
Right.
because working with the Ontario Nurses Association, we knew Ontario had stellar, strong guidance for healthcare workers from long term care, community, and acute care, and they were higher than what the federal government was suggesting. So we were telling everyone, follow Ontario again, like we had told everyone, follow Ontario for SARS, and not SARS, sorry, for H1N1, follow Ontario for Ebola. They have the strongest guidance measures for PPEs. Why? Because they learned from SARS.
Right.
And then something happened in the weekend, and I still remember Vicky McKenna calling me on a Sunday morning, said, Linda, the shit's going to hit the fan tomorrow
Oh, no.
because they're downgrading. And we were there. How can they downgrade? We don't know how the virus is translated. And then they downgraded in Ontario, and the rest of the country followed suit. And that's why we have close to 20% of healthcare workers infected. And we will come and find out what happened that weekend. And if you remember with SARS, and Mr. Possami says it, SARS was what, 2003? We had two waves, mostly focused in Toronto, a little bit in Vancouver. But it took 2 years for the science community to confirm that SARS was transmitted through airborne. 2 years, two
Wow.
years after the fact.
Yeah.
And that's why Justice Campbell was so solid on, we need the precautionary principle when we're talking about the lives of patients, but the lives of our healthcare workforce. And Ontario had signed on and was following this until that famous weekend in March 2020.
Yeah, could you
Hmm.
maybe elaborate a little bit more on the precautionary principle? Because I did read a little bit about it, and just for some of our guests who might not even understand, like, what is this precautionary principle?
So the precautionary principle, it's what we do all our lives, especially when we're parents. It's when you don't know, you go on safety first. So the precautionary principle in our healthcare system, we ask our nurses, our healthcare workers, physicians, etc., to do a point of care of risk assessment, which means before you enter a patient's room, a patient room that might be infectious to a virus or to a bacteria, you need to protect yourself. So you will wear the gowns, the gloves, the mask, etc. But when you know the patient is infectious, but you don't know how and how it's transmitted, then you up your precaution. And that's where
Right.
the famous N95 respirator comes into play. You have to make sure you protect yourself by airborne, just in case. And then when all the tests and all the science is out, and they tell you that the virus or bacteria is not transmitted through air or contact or other venues like blood, then you downgrade. And for those of us who worked, and it was very early in my career when HIV came into play, you will remember how we were really taking precaution with any HIV patient because we didn't know how it was transmitted. And then the science became a lot clearer on how it was transmitted, and it transformed the way we provided care to HIV patients. And we're seeing this with these kinds of respiratory viruses. It will transform the way we provide care, but we need to be a lot more careful in the beginning when you don't know. And that's the precautionary principle. When you don't know, you dress up. I often use the example of firefighters. They don't know what is causing a fire in a house, especially in the industrial sector. So they have to put gear from head to toe, special masks, special respirators before they jump in to save lives. We never question the cost of that. But
Right,
for
right.
our healthcare workforce, our nurses, we question their professional judgment and we question the cost of the equipment.
Absolutely.
I'm glad that you brought that up, Linda, because I often liken the PPE to, let's say you're on a construction site and you can't work unless you have your hard hat and your boots. That is never questioned. But of course, like you said, the
Mhm.
PPE is questioned. And then it becomes this struggle between what nurses know they need versus what the hospitals are saying, or, what the budget allows for, what the availability is. And I know that some nurses, because they have felt there was a lack of support, they have even turned to social media to voice their concerns. And I'm just wondering what your thoughts are on that. What do you think nurses should do if they feel like their voices aren't heard? They've already gone to their manager or the hospital administration, and nothing is being done.
Yeah, and before you answer, Linda, I just want to quickly read out something from a document that I found here. So, in other provinces, there have been similar efforts to silence healthcare professionals who speak out about the lack of appropriate protective equipment. So, a nurse in Ontario had stated, "Hospitals are telling us to keep quiet about this information and even threatening to fire staff." There have been many other media reports where nurses are afraid to be identified because they fear discipline or being fired or reprisal. So, social media is so important at this point in time. What do you have to say to nurses in terms of speaking out about what they're seeing, whether it's about long term care, whether it's about the crisis? What can we say about this whole social media aspect?
As much as it's an important question, it has two sides to it. It's almost a Jekyll and Hyde here.
Mm.
Social media can be your best friend. You can keep informed, but you have to make sure that one, the right information is getting out, and you're receiving the right information. You know what they say about data: garbage in, garbage out.
Yes.
So we really have to be careful of what we read on social media. My message to nurses: always speak up and speak out, but make sure that you're doing it into a safe way. We can never talk about patients, because patient confidentiality is what we promise our patients, what we promise our community, that will be sacred. So whatever you say, you have to have your little notes. You can't identify which shift you were working on. You can't identify which unit you were working on, etc., just in case there's a parent or a family member listening and thinking, oh my God, Nurse XYZ was working the night my father was there, and this and might happen.
Right.
So that I'm very strict on how the nurses use social media, because they will get in trouble, and their union represents them and protects them, but we warn them in advance.
Right.
About speaking up in regards to not enough PPEs, not enough staffing, that do it all the time.
Mm.
And follow your unions. I follow a lot of nurses and other healthcare workers, and sometimes I wonder, okay, did you sign any of our petition letters? Did you write any of our campaign letters that we did to Doug Ford and the rest of the crew of the politicians in Canada on this issue or other issue? Or give us suggestions on what can we do to make it simpler for you, because we know we use all the tools available to us, but maybe we're not reaching. So just do it safely, and if you can, use the tools your unions, your association, not your college. Your college would never ask you to be politically
Right.
active, let's be
Absolutely. Yeah.
honest, but your union and your association will, and use those tools. And then you can be guaranteed that you're quote unquote safe. But employers will push the limits.
Yeah.
They will. They'll ask you to shut up and accept all kinds of things.
Right. And I think you've actually touched on a really good point there. So our union bodies encourage us to be able to speak out, but we do feel that silencing from, our regulatory body like the College of Nursing. And I kind of went back and I was like, let me look at some of the language that they've kind of put out. So they have this whole like reflect before you post. So ask yourself, is the
Mm.
purpose of the what is the purpose? Does it reflect negatively on the profession or me as a healthcare professional? Will posting this information undermine my colleagues or portray my workplace in a negative light? Could my post cause a breach of confidentiality, privacy for clients, colleagues, and the workplace? So, kind of what you were saying, Linda. Again, I think it's fair. We shouldn't be there, like, under no circumstance should anybody be using patient identifying information, even workplace identifying information. I think that goes without saying. Do I think that some of the language that the CNO has even put in this document make it more fearful for me or other nurses to feel it's safe to post? Absolutely. And I don't necessarily see this in other disciplines. So I actually also went back and read what like the CPSO said, so what the College of Surgeons and Physicians say. So they do say, you are the owner of what you post. You need to be mindful of it, but it doesn't seem like this kind of threatening type of language. And I feel like if you're not talking about patient care, or you're not breaching confidentiality, you're not disclosing anything about your work, but you're being honest and truthful in what you're seeing, I don't see the problem. Or again, and you're not being egregious or racist or any of those types of things, I think you should be able to speak your mind. It's that whole principle of freedom of speech. And we see it again in I guess this is a very highlighted case, the story of Carolyn Strom. So I think, well, I followed her, I guess her story from about 2015. And when she was actually it came down as a ruling where I think she was made to pay a fine, and then eventually kind of came back full circle in talking about what can nurses say, what can nurses not say. And I felt that the ruling, when they had overturned the ruling, the right to participate in social and political discourse is an important aspect of our personal autonomy and freedom of speech at the heart of, our liberal democracy. So even though the court did not necessarily need to address her specifically or address her charter rights, having founding that there was no misconduct, they nevertheless upheld these rights. So I just feel that, like you said, it's important for us to speak our truths, obviously not adding in those other elements of patient confidentiality or naming the organization that we're working with.
Yes, it's like you're not going to ask me to defend the college for sure. Uh, their language is written by 1,001 lawyers.
Yeah,
And yes, their hope
Yep.
would be that you never speak out. So, taking that into consideration, I always say never post anything when you're angry.
I
Never
agree.
post anything where your emotions are either too happy, too mad, too sad. just take a breather and come back. So their comments of reread your before you post makes perfectly sense. In Carolyn's case, her first court appearance, and we give her all the credit, like that is, she is, and I know personally, she's a strong, solid woman, and she pushed this case when nobody was telling her she should continue.
Mm.
Because the first court case said, sorry, Carolyn, your provincial government gave that power to your college in Saskatchewan. It's an association, but you agreed to that. We agreed as nurses to be self-regulated. By being self-regulated, it means that there's a provincial act in each province, to call something else, that gives someone like the college to do what they want. And that we could have another
I
show
was gonna say
completely
that's a
on
whole
it.
other episode,
But
Linda.
exactly. But it stops us. But then, as individual, we have to shake our heads and say, okay, no, I want to be self-regulated because I want the public to know that I'm licensed, that I haven't been disciplined, that I'm a good practicing nurse.
Right.
That's the extent they should practice. But we've expanded that. We've expanded it across the country, and we have a lot of work to do. So go back to your original message is, yes, we have to speak up. And the more we speak up, and the more we speak up as a collective, the stronger we are. Look at teachers, look, especially in Ontario. Look at the strength of the teachers, what they did last winter, where the 4 or 5 organization unions representing the teachers all banded together from different, and they come from different unions, different culture, representing different people, different workers, and banded together and told the Ford government, enough is enough. We
Yes.
need to be able to do that in nursing. We have to not only support nurses, but support the care workers. The whole care economy as being ignored in this country uh, for years and years. And now we wonder why we're hitting a wall with this pandemic.
Linda, you have my heart. Honestly,
That is
like,
so
you
well
just
said.
have
This is
my heart
everything we
today
stand for.
because, like, everything you said. Yeah, like, everything you've said is just like, boom, exactly what myself and Sarah have been thinking. And I think this current crisis with COVID-19, it's really shown us how using various different channels, we can actually really bolster our voice. And I agree with you. I keep on saying this thing. I said, if we looked at how many numbers we have, like even just internationally, I say we are 20 million nurses strong. If we could just band together and use our voice, I feel like we would be a force to be reckoned with, honestly, in terms of our profession, in terms of understanding the work that nurses do. I don't feel that people fully can grasp how important we are to society, to health, and to others, and even to ourselves sometimes. And I feel that nurses shouldn't have to always have to jump through all these bureaucratic hoops in order to point out failures in the system. If we see it, we should be able to call it out because it does impact patient care at the end of the day. And I know deep down as a nurse that our hearts are there for patient care. We want to see improvement. We want to see change. And the reason that we might be speaking out is because there's something important that we need to say.
And saying that, Amy, we shouldn't go through hoops to speak up, but there are so many tools that are disposable to speak up, and we should just learn about them. Now, not every nurse in the country are going to do like the two of you and create a podcast, uh, and do interviews with your guests before, and then the podcast and the cleaning up. And people don't know, but Sarah is in the closet right now because her children are from home from school, and that whole but that's life.
Right.
That whole balancing act. And then people say, I can't do that. Well, we're not asking you all to create a podcast. What we're asking is look at the tools that exist, either
Absolutely.
distribute podcasts, look at your union's websites, what kind of actions are there, that it's just a click. Now everything's a click on your phone, on your computer, your association, they do the same thing. or your community groups. It's easy. But when we do a petition and there's 9,000 on 200,000 that sign, well, that shows government, well, they're not that serious.
Absolutely. Know where the
Mhm.
tools are, know
Yeah.
how to access them. Absolutely, I agree.
And my advice for nurses, anyone that wants to start being more vocal, advocating, I was going to say, just to add on your point, Linda, the more that people start to use their voice and advocate, I think it's a learned skill. So for myself, even starting this podcast, I was very nervous to do so. I was worried about what people might think if I said the wrong thing, but I think it's just more about going out of your comfort zone, and as long as you maintain confidentiality and you are saying things that are evidence based, then there's no harm in using your voice to advocate for the profession. And that's what we're all about. We want to move the nursing profession forward. We want to highlight issues that affect nurses. It just so happened that we started this podcast before the pandemic, but this is always at the forefront of what we stand for. And so I would encourage any nurse that wants to be more active to just start and take baby steps and keep going. So that's what we want for everyone.
Absolutely. So we talked about what the CFNU does. We talked about the document A Time to Fear. We've talked about social media, but I want to get to this one last topic because I feel it's really important, and I believe it's important to you as well, Linda. Mental health. So one of the documents that I saw on the CFNU is that you guys support mental health and mental health of frontline workers. So a statement I pulled from the document said across the country, nurses and healthcare workers are experiencing a silent mental health crisis. Short staffing, pushing workloads, widespread violence. These are everyday realities contributing to the stress and trauma of health that healthcare workers are suffering. What can we do to continue to push the message forward and to get more support and awareness for our nurses who are doing this battle day in, day out?
It's that's what's keeping me up at night, honestly. The fight for PPE, we are winning it. The fight for mental health, it becomes such an individual battle that nurses think they're super nurse.
Yes.
They can handle it all and they never ask for help. And that is the scary part. You talked about our study. Our study was done pre-COVID, where 36% of nurses showed sign of major depression, 38, sorry, of PTSD. And when you compare that to the general population, it's only 8%.
Wow.
So we're 3, 4 times higher than the general population. We're at the same level as police officers. And people think, what? We're at the same level of police officers for violence in the workplace. And people say, what? And nurses forget that there's help out there. And during this pandemic, I've been saying stay safe and stay strong. And by being staying strong is you need to know when you have to take a breather and go ask for help. We've signed on a partnership with Health Canada. They have an amazing online resource called wellnesstogethercanada.ca, and you can do your own analysis. You can get online resources. You can even go and talk to a counselor of whatever. We're working with them to see if we can do a peer-to-peer support group for nurses and healthcare workers to go to dive even deeper in this. But the key is to ask for help. And sometimes from your coworker, you can go to your union, you can go to online source, and we're there. We just need to know you're not superwomen or superman on this issue.
Yeah, we see that trope, right? Nurses are superheroes. Like you see lots of images about this whole hero mentality, and it's almost like martyrdom, right? It really concerns me because I feel like I've been there too, where I feel like I'm this superhuman. I could do it all. I can take it all on. I'm dealing with patients' care because that's what's most important. That's where my heart is. But I forget about me. And I think especially during this crisis, you can't forget about yourself. Like, you have to take the time. I'm reading so many painstaking stories about people saying that they're going to leave the profession, nursing students that are in saying, should I even stay? Should I commit? Like, and I think that we need to continue having the conversation about mental health, because I think people might not even recognize when it's actually really impacting them. Maybe they're having sleepless nights, or maybe they're having anxiety where they didn't have anxiety, or, maybe it gets to that extreme point where they do have suicidal ideation. I think we just have to continue to talk about it, and we need to point people in the right direction. And one of the things Sarah and I want to work on is creating a repository of where people can find support. Frontline healthcare workers can find support to make sure that, in their communities they know where to go if they need help. And I think people, especially nurses, we are really bad at asking for help. Like, really, really bad. Like, even when we're on the unit, sometimes it's like we're in a flurry, we don't ask for help. And I think at this point we need to encourage people, if you're feeling that stress, that you just need to reach out and ask for help.
hmm Linda, I just wanted to thank you for coming on our podcast today. I think you touched on a lot of important issues such as mental health, advocacy, social media use. You gave us a lot of important background information on the pandemic. And I think what you said today was vitally important and validating to me. So thank you for coming onto our
Yeah, thank you
podcast.
so much, Linda. You are a force to be reckoned with. You are definitely one of the most fierce nurses I've met. I can't believe it's taken so long, but you are amazing, and I'm so glad that we were able to have you on today. Hopefully, we'll have you another time. We didn't even get to touch on violence in healthcare, workplace violence, and I think that's a huge topic, but maybe we can have you back another time that we could talk about that as well.
For sure, you made it very welcoming and easy. So I wish you both great success with your podcast. It's exciting to see nurses taking on new initiatives like this, and I commend both of you.
Thank you so much, Linda.
Linda.